I noticed a small lump, and Dr. Dwyer was like, well, let's get this checked out. She got me scheduled for a diagnostic mammogram and ultrasound. It was very similar to my regular annual mammogram, but it focused on the site where I felt something versus the entire breast.
I became involved in Mrs. Easley's care after her biopsy. So she had had a prior mammogram, which was normal, but then in the interval before her next mammogram, felt something abnormal and very appropriately went to her physician for evaluation. Additional imaging was obtained, which found a new abnormality which had not been seen on her prior imaging, which prompted a biopsy and led to the diagnosis of cancer.
Cancer is a complex disease, and it takes the expertise of many physicians, many practitioners, many support staff to provide the best care.
I'm going to kind of scroll through that so you can kind of get a glimpse of that demarcation.
We have tumor board meetings. Cases are presented to a group of physicians, experts in the field, and we talk about it in a collegial way and help our colleagues throughout the system in coming up with the best plan.
We have a routine meeting basically every week, and then I as a radiologist would present the imaging findings. The other team members, they'll discuss their perspective. The pathologist will review what they've seen, what they know.
We're trying to find out what the stage, that is how advanced the patient's cancer is. Is it just limited to where it started, or has it now spread or metastasized to the lymph nodes, through the blood system to another organ? Sometimes key questions can help the whole team go in a little bit different direction. And I think that collaboration is very valuable to all of us who provide oncology care.
Having that close contact really helps us to advance the patient's care and make sure that we're all working as a team.
I think it was very important that there was a collaboration, so this way I wasn't running around and trying to piece it all together myself.
Mrs. Easley opted for a bilateral mastectomy. We use a procedure called sentinel node biopsy, which uses mapping of the lymphatics which drain the breast into the axillary lymph nodes so that we can remove just those lymph nodes which are involved in draining the part of the breast that has the cancer. In the past, we used to have to take out all of the lymph nodes to ensure that there was cancer in them, but this mapping procedure helps to limit that kind of complication that we saw with those patients.
We're also performing molecular and genetic testing on patients' tumors. If a patient has a certain molecular target, that target can be utilized by our medical oncologist to give the patient a certain type of chemotherapy or immunotherapy or some advanced therapy. Every time I'm looking at their slides through my microscope here, or collaborating with others in the laboratory or in other medical specialties to try and always think about how can I help the patient further their care with best and most accurate diagnosis I can render.
Having the Riverside Cancer Care Network reassured me that there wasn't just one person looking at my case. Every decision was a collaboration to figure out the best treatment for me.